So who needs a lip lift? A lip lift is actually my favorite procedure. It actually makes a huge difference in the face if your upper lip is too long. So the most attractive upper lip is short and full. So you want to, if you looked in the mirror, just open your mouth slightly without, using a lot of motion to your lips. Just open your mouth while it's relaxed, and if you don't see your upper teeth, then you're the perfect candidate for a lip lift. If you look at any fashion magazine, most models will actually have that pose, and you'll see their upper lip if they have their mouth open. What is getting a lip lift procedure like? Well, I do it right in the office here under local anesthesia. So there's no need to go under general anesthesia or even sedation. Although, some of my patients are getting a lip lift at the same time as other surgeries, and that's, a different story. But I do these in my office nearly every week. People come in from all over the country to have a lip lift because even though in theory a lip lift is fairly simple, you have to do quite a few lip lifts to really fine-tune the art of designing the amount of skin to be removed and to not take too much from one side or the other or in the middle. Some people get too much skin taken from the middle part of the lip and end up looking like bunny lips, which we don't want. So after you're numb, which is the hardest part of the entire thing, it takes about 30 minutes, and you have a row of stitches right under the nose here where they hide. Those stitches come out in a week. For as far as recovery goes, after the stitches come out, it will look raw, and at that point keep ointment on it, but once the rawness goes away, change to a sunscreen, and I recommend a zinc oxide sunscreen. The key is to not stretch the lip at this point. So the first few months after the procedure, you don't want to do movements like this, and it'll feel tight, and so it'll be hard to not subconsciously move your lip because it'll kind of bother you a lot. But as long as you keep tension off of that incision, the incision heals virtually invisible. And so, but for the first few months, you can put concealer on it. You can't really see it as far as the color. And so after that period is over, you don't have to worry about it anymore. I have quite a few patients ask me, can they fix asymmetries in their upper lip with a lip lift? And the answer is yes and no. And it depends on what the asymmetry is from. So I consider a upper lip to be basically 3 different areas, 2 on the side and 1 in the middle. If you have one area of your lip that's a little bit higher, usually that's from one side of your face being slightly smaller than the other side, and everybody has slight asymmetries to their face. That can be repaired with a lip lift, and that just means that segment won't go up quite as high as the other side if one side is higher than the other. If the asymmetry is only with motion, so for some people when they talk, one side of their lip kind of tends to go up a little bit more than the other side, that cannot be addressed with a lip lift, because in a lip lift I do not touch the muscle at all. It's literally just removing the skin on the surface. If you take pieces of that muscle, sometimes the muscle movement around the lip itself looks very unnatural and can pull in different areas, and I just don't like the way that looks. One option in that situation is to add a touch of Botox on one side versus the other, but not a lip lift. So what do you do if somehow your scar does not heal right? Well, everyone heals very differently from one person to the next. I can use the same technique on one person and not have a scar at all versus another person who forms keloids, and I really have to pay close attention to it for, and see them back on a more regular basis. So when I first start to see the scar thicken, and this is usually as a result of tension on the scar, so anytime you have tension, meaning forces that pull the scar away, it can thicken any scar, whether it's the lip or anywhere else on your body. and you talk a lot and move your lips even when you're not talking, so most people don't really realize how much stretch gets put on that incision. But there are options, and so the first line is usually injecting a tiny bit of a steroid solution into it, and that'll usually tamp down the scar and the thickness of the scar. If that doesn't work, another option is to do microneedling, and that pokes tiny holes in the skin so that it promotes collagen growth, so it actually kind of covers up the scar and forms new regular skin. Another option are laser treatments or even radiofrequency microneedling, and those work just as well. They're just a step up from microneedling. And the last option would be a scar revision, and that's if the scar just kept growing so much that it was too thick to address with any of the other options. I can actually cut out the scar and start fresh.